From the campus of the University of Nebraska at Omaha, consider this with Cathy Wyatt, a program of issues and information behind today's news.
Flu outbreak is reaching new heights. The CDC says doctors' visits for the flu have hit their highest levels in almost 3 decades, and there have been at least 11 million cases so far. 45 states reporting high or very high flu activity.
Hi everyone, I'm Cathy Wyatt. Welcome to the 29th season and this week's edition of Consider This. Our topic, viruses and vaccines. Joining us to talk more about it is Dr. Mark Rupp. Dr. Rupp is a professor and interim chair of the Department of Internal Medicine at UNMC. Thank you so much for being here and welcome back.
Well, thanks. It's a great privilege for me to be here.
Thank you. We're going to start with, what is a virus?
Well, that's a fascinating topic, and viruses are very small, much smaller than bacteria, cause a wide range of infections. And the interesting thing about them is that scientists argue kind of back and forth, or are they life forms? So they don't have the ability to replicate, to store energy, to make proteins, and they completely rely upon the cells that they infect for the ability to do that. So they're kind of the ultimate parasite.
How do they work?
Well, they adhere to your cell. Usually they have a little protein on the surface of them. So a good example of that would be the spike protein that everybody knows about from COVID-19. That allows that virus to specifically interact with cells in your body that have a certain receptor. Then they're taken up by the cell and they essentially hijack the cell's mechanisms for creating proteins and replicating. By doing that, they disrupt the function of that cell. So that's why you get an illness when enough cells are infected. And that also incites an inflammatory response that causes a lot of the symptoms of a viral infection. So for instance, when you get a cold, your nose makes a lot of mucus, you cough, you have a sore throat. Those are all signs that that virus is in those cells replicating and causing inflammation.
Oh my goodness. Okay, this time of year, we're going to put up a graphic for our viewers. We talk about 3 viruses in particular: influenza, COVID-19, and RSV. So briefly tell us what's important to note about each and maybe what isn't so typical about them in 2026.
Well, they're all very typical what we call respiratory viruses, and so that implies that they're spread via a respiratory route. So when people cough or sneeze, they spread the virus to other people. They all are seen more frequently at this time of the year during the winter. We don't really have a great explanation for that. We do know that these viruses survive better when the air is colder and drier. That's at least part of the explanation for that. There's also a growing amount of information to suggest that cold weather causes some perturbation of our immunologic response within our mucous membrane, so our nose and our throat, allowing these viruses potentially to be more active and to cause more disease.
Okay, so how do they spread then?
Well, again, when people cough or sneeze or even just breathing or talking, you have a lot of virus that gets expelled. We certainly learned this a lot during the COVID-19 pandemic, that even just simple talking and breathing would spread these viruses into the air. Then people breathe them in, they gain access to where they cause the infection, and then they're off to the races.
Okay. Measles, we don't typically hear about yet making the headlines right now. How serious is it?
Well, I think that measles is really the canary in the coal mine. That measles is very, very contagious, and when we have problems with the number of people accepting a vaccine, we then start to have outbreaks of measles. So measles is a serious disease, and we were able to eliminate it from the United States back in 2000. Unfortunately, because of decreases in vaccination, introduction of measles from other parts of the world, we've now started to see measles spread, sometimes widely in communities, causing big outbreaks. Last year we had more measles cases, over 2,000 cases, much, much more than we've ever had for decades.
Gone untreated. Remind us, and you shouldn't really need to do this, but remind us of what the consequences can be.
Well, measles is a serious disease. I mean, again, back decades ago, it was a childhood disease. Pretty much everybody got it. It's really the most contagious virus, or almost the most contagious virus that we know about. So it spreads very, very easily. And again, that's why I call it the canary in the coal mine. When you start to see that, then that's the first infection you're going to see. And then over time, when people stop getting vaccinated for other things, you'll see those other infections start to occur as well. So measles is a serious infection. About 10% or so of people who get measles now will go into the hospital. So this is, serious enough to cause people to be hospitalized. And then the mortality rate isn't tremendously high, but it's somewhere in the neighborhood of about 1 to 3 people who get infected, despite our modern day healthcare, will die of that. So 1 to 3 per 1,000 persons who get infected. There's a lot of side effects from it and other complications. About 10% of people will develop severe diarrhea, sometimes malnutrition, earaches. Some of the more feared complications are when it gets down into your lower respiratory tract, causes pneumonia, and then one of the more serious things that can cause encephalitis or brain swelling. These are some of the causes for death. And then something that's really unusual about measles that I don't think many people appreciate is it can cause what we call immunologic amnesia. So it actually causes your immune system to become much less effective, and then you can get other infections, sometimes things that you should be immune to. So for instance, you'll get people who develop chickenpox or some other viral infection that you thought that they're immune to, but their immune system just has stopped and has sort of forgotten how to act.
Wow. Okay. Containing the spread, obviously very, very important. We're going to talk about vaccines in just a minute, and we'll put up another graphic for our viewers. Staying at home, so very important. Talk about why.
Well, it's what we should do to help our fellow community members, right? So when you're sick with a cold or flu or some other illness that you could potentially transmit from person to person, you want to stay home. Don't go back to class, don't go back to work. Get better. Typically what we tell folks is after they have been without fever for at least 24 hours, without taking Tylenol or aspirin or anything like that, and they're feeling better, then they can come back to school or come back to work. But it's important for folks to stay home, not share those viruses with their classmates or with their workmates.
So, Dr. Rupp, when we're sitting at home with nothing to do, feeling bored, what are some steps that we can be taking so that by the time we are ready to go back, we might just be better overall?
Well, I think most of the things are kind of what your grandma told you, right? So you just really want to stay home, rest. There is some data to suggest if you exercise vigorously while you're sick with some of these viruses that you can then develop other complications. Cardiomyopathy is one of the more feared ones. But you want to rest, you want to get plenty of fluids, eat well, and then let your body heal.
Okay. Treatments right now, how are we treating these viruses?
Well, there's some that we have decent therapy for, and there's others that we don't. And so, for instance, measles, there is no treatment for that. And that's, again, one of those tragedies that this is essentially a completely preventable disease. This is a disease we could actually eradicate, like we did smallpox, if we were aggressive and we had widespread vaccination throughout the world. We could get rid of that disease. But in any case, there is no treatment for measles. We do have some effective treatment for influenza and for COVID-19. We have vaccination for RSV, but no effective immediate treatment. So that's why it's important to get vaccinated for some of these things. But also, if you do develop flu or you develop COVID-19, and you're particularly at high risk of complication, I really think you want to go get a diagnosis because we can start therapy if it's done quickly enough. So typically within a day or so of somebody feeling ill, if we can start treatment, we'll make that illness much less severe and we'll make it much less likely that they go on to develop complications from those diseases.
Can you do me a favor? So when we visited in the past, we've talked about some of the similarities in terms of symptoms with some of these things. Can you kind of break that down for us again in terms of, okay, this is the cold, this may be more likely, because you're talking about getting a diagnosis, and I think there might be folks out there going, oh, I'll just let it pass, or it's probably just a cold, and dismissing things that could be more serious. So how is it that we're able to really differentiate between some of these viruses?
Clinically, it's extremely difficult. There's a lot of overlap between a lot of these diseases. So even well-trained, experienced clinicians will not be able to tell you, oh yeah, that's flu versus COVID-19 versus RSV. Sometimes sometimes there are a little bit of clues as to how they present and some of the symptoms, but for the most part, there's too much overlap to really tell the difference, and so you need to get tested.
Okay, all right. They say an ounce of prevention is worth a pound of cure. What is the ounce in this case?
Well, the pound of cure, again, if we were able to treat some of these things, that'd be fine. But clearly, trying to prevent these diseases is much more effective, and it's the smart way to go. So that would be vaccination.
Okay, and that's what we're going to go to right now. So remind us how they're developed and the importance of accelerating the process, such was the case with COVID-19.
Yeah, so some of the technology that we use to develop vaccines is very old. So for instance, the flu vaccine is still largely made from chicken eggs, from hen's eggs. And so you grow the virus within the egg, then you harvest the virus, you kill the virus and purify its components, and then use that as the vaccine that will stimulate your immune system. Now, there are better ways of doing that. You can do it in cell culture. You can actually do some recombinant ways of raising the virus. So there are more effective ways, but we still, for the most part, with our flu vaccine, make it in chicken's eggs, believe it or not. The COVID vaccine was a remarkable accomplishment. I know a lot of people don't fully appreciate that, but to go from having a new diagnosis to having an effective vaccine in less than a year is unbelievable. And it's really predicated upon decades of work that was done with mRNA technology. And so that's another thing that I would love for people to understand, is that these scientific breakthroughs take years and years, sometimes decades, of preliminary work, and you don't really see the payoff sometimes for that basic science research. And that's why it's so dangerous. Like, we're right now facing all kinds of budget cuts at the NIH. That's going to have downstream replication or ramifications that we don't really understand.
Okay. There are some folks out there who claim that the vaccines themselves are harmful. We're going to put up a photo here, most notably the U.S. Secretary of Health and Human Services, Robert F. Kennedy Jr. Dr. Rupp, what is his argument?
Well, first of all, I will say that there are no perfect vaccines. Okay, they do, in rare circumstances, cause side effects and toxicity and problems. And I think that's where, sometimes people want to ignore those, but those are real. But those things way down compared to the bad effects of the disease. And so if you look at it and you're trying to weigh the pros and the cons, the benefit of getting vaccinated far outweigh the small risk of having an adverse event from the vaccine. So it is the best way for society to continue to go and to protect itself. And really all you have to look at is, the proof is in the pudding. So if you look at what society was decades ago before we had measles vaccine, we had hundreds of thousands of kids getting sick, thousands of deaths, many kids having downstream problems from encephalitis or their earaches or what have you. That was essentially eliminated from this country by getting vaccinated. And the vaccine is safe, it's effective, and clearly what we're seeing now is if you don't keep your guard up, that virus is still out there in the environment. And when we see pockets in the community that have chosen not to get vaccine, we're going to see these outbreaks.
Is there anybody who shouldn't be vaccinated?
Yeah, there are. And that's another thing that needs to be evaluated. So for instance, MMR, measles, mumps, rubella vaccine, is what we call a live virus vaccine. So it's actually weakened, attenuated viruses. But people who are very immunosuppressed shouldn't get that vaccine. And so that's another reason why the rest of us need to get vaccinated, right? Because there's a small number of people who can't get the vaccine because they really do have problems or contraindications to getting the vaccine. It's up to you and me and all of us to get the vaccine to protect them.
Okay, so briefly, for viewers who are watching still a bit skeptical, wondering which side here to lean to, when we talk evidence, right, against a claim such as the one that we've just been discussing with Robert F. Kennedy Jr., in a nutshell, what would you tell those folks who are still on the fence? What would be that thing that you think you could say that would maybe push them to considering getting it done?
Yeah, well, Unfortunately, sometimes these anti-vaccine messages are really amplified inappropriately. And so, for instance, RFK Jr. Has decades-long track record of, through his words and through his actions, of being not in favor of vaccination. Clearly that is weighing against, or the evidence would suggest heavily against, that sort of approach, that vaccines are the best way that we can protect our population. And again, what I would suggest to people is that they simply go back and they look at the information from what it looked like before vaccination. And if enough people don't get vaccinated, that's what we're going to go back to. So again, the proof's in the pudding. Look at what it was like before vaccines. That's why we need to continue to vaccinate. There's lots and lots of claims against vaccines that are just been debunked over and over and over again. I don't know what causes autism, but I'm pretty doggone sure that it's not vaccines. So that's one that, again, has been debunked over and over again. And the way that the anti-vaccine proponents sort of continue to throw up barriers to vaccination. They just raise questions, right? So, initially it's the autism thing, so then you debunk that. And then they say, well, it's not actually the measles vaccine, it's the preservative that the vaccine came in. Okay, well, all the preservatives have been taken out of the vaccine, all the mercury's out of the vaccine. We still see autism, so that's obviously not it. Oh, it's not the preservative anymore, it's the combination of the vaccines or the order that they're given. So you just have to keep throwing down these barriers, and we keep breaking them back. But once the doubt is established, it's very hard to regain that trust.
Talk with us a little bit with the number of viruses we're discussing right now. When you go in to get vaccinated, can you do all of that at once, Dr. Rupp? Is there a schedule that you should be? Talking with your physician, how does that work? Can you go in and get all three in one sitting, or?
So the vaccine schedule is very, very carefully scrutinized by real experts in this topic, and they've come up with, what is the best timing to get the vaccinations in order to give you the best protection. And so, again, some people are wanting to slow down that schedule and say, hey, I don't want to give my kid all these vaccines today. I'll rather get them today, and then I'll come back 6 months and get the next batch. That's dangerous, because during that time period when you're not getting the vaccines according to the time schedule, your child's at risk. And so these really have been carefully formulated, looked at over and over again, over decades. This is what we should really be doing as a measure to protect our kids in our society.
So with this being, in the headlines right now, and parents watching all of this shake out, how does this affect the recommended childhood vaccines? In a nutshell, what are we talking about here?
Well, currently, they've rolled back the vaccine recommendations a little bit through the CDC, and what's been done is, we've patterned our vaccine schedule now after Denmark for some reason. I don't really understand why Denmark shouldn't be patterning their vaccines after us, frankly. There's some sort of a belief that just inherently fewer vaccines are better, and that's just not true. The more we can vaccinate and protect ourselves, probably the better off we are. Unfortunately, in Denmark, it's not the same country as the United States. And so some of the things going on in Denmark just really don't have any parallel in the U.S. They have a very much stronger public health system, a much greater access to diagnosis and to testing and to availability for their clinicians. So they might not need quite some of the same safety net that we need in the United States, because it's harder to get into a provider, it's harder to get a test. There's just a lot of things within Denmark that are different in the United States. So for instance, in Denmark, they have 100% prenatal care. They have 100% testing for hepatitis B. In the United States, we have women who don't get any prenatal care. They don't get any testing for hepatitis B. And so trying to rely upon, we should only give hepatitis B vaccine to pregnant women who test positive, in the United States, that doesn't make sense, because we miss a lot of folks. In Denmark, they catch all those people.
So what are Nebraskans supposed to be thinking right now, Dr. Rupp, with everything that you've just stated and what they are seeing in the news, what they believe they're hearing, and what's really being... How is Nebraska impacted by all of this?
Well, Nebraska does get impacted by it, even though the recommendations have changed to shared decision making is what we term it. And that seems to imply that that hasn't been present all along. It's always been shared decision making. Parents have always been able to go in, talk to their clinician, raise these questions, and nobody forces folks to get vaccinated. So instead of it being a routine recommendation for all people, it's been changed now as a recommended vaccine with shared decision making. And inherently that sounds great, but the problem is that, again, it's difficult to gain access sometimes to your healthcare provider to have those conversations, and it introduces a little bit of doubt that people say, well, if it's shared decision making, maybe this isn't recommended for everybody. It is. It's recommended for all people.
What would you say to those most vulnerable populations, talking specifically about kids and older adults? What is it that they should be thinking and doing and so forth right now?
Well, that's the population that really needs to be paying attention and really needs to be protected by vaccines, because they're much more likely to have a more severe infection or the complications of that infection. So they need to be very proactive and make sure that they're at the front of the line to get these vaccines. Be talking to their clinicians, educating themselves, and then making sure that they take advantage of these ways of protecting themselves.
So talk specifically, if you would, to the parents and the caregivers, because often what one person wants and maybe what the person representing them is thinking should happen are two different things. So when we talk to parents and we talk with caregivers, what's important for them to know? What should they be watching for and so forth?
Well, we would hope that these people would have the health of their ward at the primary point and foremost in their mind. If that's the case, then they are going to be wanting to have their child or whoever they're taking care of, again, to take advantage of these preventative methods, prevent these diseases that can be particularly serious, particularly in the very young, the very old, those that are infirm. Those are the people that we're talking about. They need to be the ones that get protected at the very most.
It seems like when we got a little bit further away from COVID, especially in the early days, it's like the further away we get, maybe people's guards aren't quite as high as they should be. So like when you go into a senior living community or a preschool or something, are there steps that you think maybe we should go back to taking to help reduce the we're still hearing about COVID, especially in the senior living communities. So is there something pretty simple that folks could be doing to make sure that we are helping prevent the spread of this?
Sure. So COVID does continue to be a serious illness. Now, obviously, it's not what it was back in 2020 when we were, decimating our populations, closing our hospitals because it completely overran us. So we're not in those dark days by any means. But you still have a serious viral infection that can be protected by the vaccine. Now, the problem is that when the COVID vaccine first came out, it was extremely effective. I mean, it really prevented illness. And what happened is that we quickly learned that this virus is sneaky, and the variants emerged that were able to get around the vaccine just a little bit. Even though the vaccine continued to protect against severe illness, it didn't protect against anybody getting sick, and that effect wasn't very long lasting. So it wanes fairly quickly. People have translated that and sort of interpreted it to mean, oh, the vaccine's terrible and we shouldn't get it. That's not true. The vaccine does provide good protection, particularly against serious illness and particularly for people who are at high risk. There's also information to suggest that the vaccine prevents against the long COVID syndrome. And so that's something that, again, we continue to see, not as much as we saw in the first stages of the pandemic, but that's one that even young, healthy people can get and really keep them out of the classroom, keep them from going back to work, sometimes for a long time, perhaps permanently. They can decrease their risk of that through vaccination. So this is really what people need to be doing. Again, if you're at high risk and you develop those symptoms of COVID-19 or influenza, go get your diagnosis, because we do have medications that we can start that will prevent most people from progressing to more serious illness. There's also some data to suggest that decreases your risk of long COVID. So these are things that need to be done. And then we need to take a holistic viewpoint. So people do need to stay home, do need to sequester or quarantine or isolate themselves so that they don't spread that throughout society. So there's a lot of stuff that we can do to help prevent the spread of the illness.
I want to ask you, especially with the measles being in the headlines, we actually have some young adults who are thinking, am I up to date on my immunizations? And if they're wondering that, how can they find out relatively easily? And if they find out they're not, is it too late, or what should they be doing?
Yeah, so it's not as easy as I wish it was. And the promise of the electronic medical record hasn't been fully realized. You would think that there would be a great robust database that just tracked this for folks and they could easily plug into it and find it. That's not, unfortunately, not the case. Talk to their parents, see if they have their vaccine records. Talk to their primary caregivers, see if they have their vaccine records. We do have a system in Nebraska that you can go into, NESIS, which you can plug into and try to find your vaccine records, but it's oftentimes not complete. If you really don't know your vaccine status and you're concerned, you can present to your caregiver and ask for serologic testing to see if you have immunity to those illnesses. If you don't, then you can get vaccinated. Again, in most cases, getting an extra dose of these vaccines is really not harmful, and that can be done as well.
Okay, we're talking about viruses and vaccines with Dr. Mark Rupp today. Folks wanting more information, here are a few websites that you can check out. UNMC.edu, that number 402-559-4000. Also icap.nebraskamed.com, and then CDC.gov. And I know, Dr. Rupp, in about the minute and a half we have remaining, you had some other great resources that you wanted to share with our viewers.
Well, first of all, thanks for putting that plug in for the ICAP, ICAP. That's a really great program that is funded through the CDC, through Nebraska HHS, that comes then to the UNMC. So it's a partnership between government and academia to really promote infection control. And then we have another organization that's similar with antimicrobial stewardship. So that's a great site for people to go to that you've already shown. And then, as unfortunately some of the advice from the CDC or other entities is not as trusted anymore, people can go to professional societies like the American Academy of Pediatrics, the American College of Physicians, the Infectious Disease Society of America. All of those organizations maintain really good databases and information systems to help people.
Dr. Mark Rupp, thank you so much for coming back, visiting with us today, sharing your time and expertise. Thanks for all the work you're doing out in the community too.
Thanks for having me.
You bet. Thanks to our students who are working so hard behind the scenes, and of course, to all of you for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television in the School of Communication. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call the UNO School of Communication at 402-554-2600 during regular business hours. Or send an email to cwyatt@unomaha.edu.